Well then, it's August 21st, 10 a.m. or 10:01 a.m. This is our COVID conversation sponsored by Bailey Tabernacle CME Church. And let us begin with a word of prayer. Heavenly Father, we first ask you to quiet our minds and our spirits and to let us take a moment to focus on you. We are grateful, Lord, for your presence, for your grace, for your care. Through problems and plagues, you are always with us. You have guided us, and even when there's been pain and suffering and loss, you have been there with us. So we thank you. We thank you for taking care of us. We thank you for all that you provide to permit us to take care of ourselves and take care of others. We thank you for the means that are available to us to be able to continue to connect despite this current situation. Guide us, Lord, to hear and to receive wisdom, to understand better the circumstances we are in and how we are to function in it, and to come from this time, this conversation together, more courageous, more wise, more prepared, and more grateful, Lord, for you and all that you do. Thank you for all who are on, those who will present, and those who will hear, those who will ask, and those who will answer. And may what we speak today be true and right, and for your glory and our good. In Jesus' name, amen. All right, so let me thank again everyone who is on, and I'm going to turn the meeting over to Barbara to share.
Good morning, everybody. I'm Barbara Jernigan. I'm a nurse practitioner, and I currently work with the University of Alabama. I have been with the COVID support system since July of last year, meaning that we look at every case in our system and make sure our campus is safe. So I'm up to date pretty much with the current state of affairs with the COVID situation in our state. I don't want myself to be the only one talking this morning. I really want everybody to join in and ask questions and everything so that we can answer those questions or clear up some things that you may not understand. First, I'll talk about a few things to tell you where we are right now. As you may have forgotten because it seemed like in years and years ago, but the first case of COVID was confirmed here in Alabama on March 13th, 2020. As of yesterday, we had 654,000 cases of confirmed cases of COVID, and we've had 11,942 deaths from COVID-19. This is it was very heartbreaking to me to look at these numbers because I looked up these numbers last Friday. We have 654,000 cases in Alabama. 1 week ago, we had 624,000 cases. That means that in 1 week, we've increased cases by 30,000. That's a little scary. And in that week, in Alabama, we've had 218 cases where people died in Alabama from COVID. One of the scary things also is that we're seeing a higher number of children being that are sick from COVID and are being hospitalized. As of yesterday, we had 50 children that were in the hospital from COVID. A year ago, you may have had kids in the hospital from COVID, but sometimes it was just to observe them to make sure that they were okay. Now the kids that are actually being admitted to the hospital are actually sick and very sick from the disease. July 15th, to make this kind of where we are right now, on July 15th of this year, we had 9 children in Alabama hospitals that were suffering from COVID. Right now, we have 50 as of yesterday. In the last couple of days, at least 9 of those kids were on the ventilator. So the kids are sick. I think that this new variant, the Delta variant, is causing kids to be sicker. And we do know that this Delta variant is much more contagious. So we think this is the reason we're having the much sicker kids. This is also true for young adults. And with that, in that population, we know that population was very rare that they got sick, but we're seeing much sicker young adults, meaning people from the age of 19 to 49 that are much sicker and are dying from infection with this new variant. Another thing I want to say about the children that we never talk about very much, we've heard about the multi-symptom inflammatory syndrome that we hear about in kids. We actually have 113 kids currently in Alabama who are dealing with this disease, meaning that it affects multi-systems such as heart, brain, kidneys, lungs, all at the same time. So our children are getting sick. And remember that if you're under 12 years old, you cannot be vaccinated because it has not been approved for that age range. So we have to be very diligent about protecting that group. It's no better in the states around us. We can say, well, at least we're not as bad as Florida. Florida is admitting about 54 kids per day in their hospitals with COVID infection. However, if we don't start looking at what's happening there and making some adjustments, we're going to be in the same place soon. We had the first vaccines that was approved for emergency use in the end of last year. Since then, we started getting vaccines. There was a large number of people getting vaccines, and all of a sudden, we saw the cases and the death rate going down. However, right now we see that this is the totally opposite has happened. More and more people, we're begging people to get vaccines at this point. And one of the things we're going to talk about, I want you all to please ask questions about the vaccine, why we have hesitancy, why you're not getting it, what are your fears and everything. And I want to really answer those questions if I can today. One of the things I want to talk about also is what exactly is a pandemic? I think sometimes we hear a lot of things and we think that we only think about what's going on in our own back door and everything, or around in our community. We need to remember that this is just not happening here in Alabama or here in the United States. This is happening all over the world. A lot of countries, I get so disheartened sometimes because we're out here in the streets fighting about putting a piece of cloth on our faces. But there are other countries, especially Asian countries, who dealt with similar respiratory diseases, and they put masks on. They didn't have vaccines, but they found treatments and got rid of these things. I'm sure each of you have heard of MERS, SARS, bird flu, and things like that. We didn't have those things in our country, but if you had looked at the news and when those things were going on, you looked at people in China and different places, they put their mask on. They don't have these fights about whether to wear a mask or social distance, things like that. So these are not new things, it's just new to us. They are not new to people in other parts of the world. As far as we live in a country where we are very, very, very privileged. I don't think we understand how privileged we are. The fact that the vaccine are available for us is just phenomenal. One of the things that the reason these two vaccines are available to us because our government actually put in a lot of money into this, getting them ready. I don't know if you remember when it first started, the President Trump said that we would have these vaccines ready by the end of the year. And everybody was like, oh, I even had doubts as to whether this would happen. But once I started looking at the research and everything and realized that the research that is available for the vaccines with the messenger RNA technology is by no means new. It's been around since about 15 years now. We have been trying to get vaccines to prevent flu and also to prevent HIV and other viruses for years. And the technology behind those vaccines, the new vaccines, have been there, and research has been done to try to get those two diseases under control. Unfortunately, it did not, the technology did not work so well with the flu because it changes all the time and everything. And it did not work with the HIV virus because of the way that the HIV virus changes and everything in the body. So I'm not going to go into that because I would need another class myself in order to explain that properly. But knowing that it did not work, but however, it has worked very well with the way that the coronavirus is, the way it is, it reacts. The vaccine works very, very well in making it less, making you less sick or keeping you out of the hospital. One of the things we do know that people who are vaccinated are less likely to die, and they're less likely to get sick if they are infected with the coronavirus or the COVID-19 virus. To kind of put it in perspective, from April 1st to April 18th, in the state of Alabama, we had 982 deaths from COVID-19. Of those 982 deaths, there were some people who were fully vaccinated who died. There was 982 deaths from that time, from April 1st to April 18th, but only 3 of those people who died were fully vaccinated. I don't really know how gambling works or anything, but I might be prone to gamble if I knew I had those odds. That's like 3% chance of dying if I don't, like I say, I don't gamble, but I think those are some very good odds if you were a gambling person, if you take the vaccine. Let's see, what else that I want to kind of talk about. Can I start taking some questions right now?
That is a 0.03% chance.
Yes. Yes, 0.03% chance. And I've heard people.
Just as a point of order, I muted everyone. So if someone has a question, let me encourage you at this time to unmute yourself and speak. I am also monitoring chat. So if you are online, you can send something in chat. Anyone who has my cell number, I've got my phone beside me, you can send me a text message. And that is at any time.
Hey, Barbara, this is Marcus. Can you hear me okay?
Yes.
Yeah,
yes.
Go ahead.
Good, good. Okay, quick question. I mean, not quick, but I've been skeptical because I think about in terms of my age. I'm 44. I exercise regularly and I try to eat somewhat healthy. I've been skeptical because I'm thinking how I know I need the vaccine more so than someone else who does. Am I more susceptible to get sick, or should I just say I should get the vaccine no matter what? Because I never had a vaccine since I was a kid. I don't take the flu vaccine. I've had the flu, but I think I'm pretty healthy.
You haven't had
Again, I
any
don't know, so I'm
vaccine.
asking.
You haven't
Ma'am,
had any vaccines at all, measles, mumps.
not since I was a kid. I had a measles, but I had a measles when I was a kid, actually. So I
Okay.
was 8, 9.
But you haven't taken any of the, okay.
No, no.
Our immune systems, our bodies have immunity. However, the way, in order for your immune system to work, it has to first be triggered.
Yep.
So let's say, like, for instance, you say you got measles. Once you got measles, you end up, you probably won't get measles again because you got natural immunity. Maybe you have a good immune system, but there are a lot of people who have also in your same situation, Marcus, who have been exposed to the virus and they have died. I know, I can tell you at least one person I know who is in your same situation. He was active. This brother have done maybe, I can't remember, 20 or 30 marathons. So I think I would say he's pretty healthy. he got COVID back in November or December, and he was dead in February. We were all shocked because his immune system, everybody would think, he is very healthy and everything. And to answer your question, I guess I didn't answer your question. The way viruses work, your body might start that immune process, and I can't say that your body won't fight it. However, in the case of a lot of these respiratory diseases, your body can't fight it off the way it needs to.
Okay.
And I know that's not the answer that
May I interject something?
Yes.
Hey, sometimes I think the conversation about this has been framed in absolutes that don't exist.
Yes.
So it's not the vaccine. All right, so in the movies, vaccines are absolutes. In the movies, somebody discovers a vaccine for a pandemic, a plague, zombie apocalypse, whatever, and every shot cures everybody instantly. Okay, that's not how vaccines or medicine or basically anything else works in the real world. So we're not talking about a question of, is it going to stop me from getting the disease? Is it going to stop me from passing it on? Is it going to save me? It's not a movie absolute. What we're talking about are probabilities, extents, and chances. So like when Barbara mentioned earlier, of the 982 people who died in that set, 3 of them were fully vaccinated. That means that approximates to a 0.03 chance of contracting COVID and it being fatal if you're fully vaccinated. 0.03 chance, not a 0, 0.03.
And remember, excuse me, Reverend Graves, remember when the vaccines were, nobody has ever promised anybody that a vaccine would be 100% effective. No vaccines is 100% effective against anything. However, these vaccines were anywhere from 94 to 96% efficacy, meaning that if you were, and when we say these things, statistics and especially in medical terms and everything is different from the way we think. That means like 4 people out of 10,000 would not get 4 people out of 10,000, if you are vaccinated, would get the infection based on the numbers at that time, or 6 people out of 10,000 would get the infection. So it doesn't mean that you're 100%. Nobody, if you got the vaccine, nobody who got the vaccine will get the virus. But we know that about between 4 to 6 people out of 10,000 would get the infection, even if they are fully vaccinated. So I think when we hear those things, those numbers, sometimes we don't exactly know what they mean. But no vaccine will fully protect you. Think about those of you who do get the flu vaccine. I'm sure many of you have gotten the flu vaccine, and some of you may have gotten the flu vaccine, and all of a sudden now you have the flu. It's not because the vaccine did not work, it's because it's just the way your body is made, the way, how much viral load you had, how there's a whole bunch of factors, how long you were exposed to the virus, how well your immune system is working on that particular day. Like my immune system might be top notch one day, but the next day I may have had an insult for some reason or been exposed to something and it's not working as well that day. So at that point, I might contract the flu. But what we do know is that if you get the virus, if you're vaccinated and you're protected, you have a less chance of dying and you have a less chance of getting sick and being hospitalized from those things.
Okay,
and not just in response to, well, not just a direct response from us, but because he prompted a line that I wanted to make sure we get to today. What we're talking about are questions and decisions about layers of protection. And so masking is a layer. Hand sanitizing protocols are a layer. Social distancing is a layer. The vaccine is a layer, right? So we create layers, and none of those layers is 100%. It would be wonderful if they were, but none of them are. But the more layers you have, the lower and lower the percentage of A, you contracting it, and B, which is another major thing in this, is you passing it on to someone else. So there are two things that are part of our considerations. And as a pastor, these two things are part of my considerations and decisions I make about our protocols. A, keeping someone from getting it, and B, keeping someone from passing it to someone else. So someone may have COVID. My daughter was COVID positive in 2019. My daughter,
2020, 2000.
yeah, 2020. Yeah, 2020. I'm sorry, they run together. 2020. My daughter was COVID positive. She her campus was already COVID isolated. She socially isolated. She weathered that and came through with no lasting problems. But while she was COVID positive, she was also COVID contagious. So it didn't cause her any lasting problems. She was sick for a while. She was very sick for a few days, but it was like a bad flu. That was her case. All right. But she could have very easily given it to someone at that time who couldn't weather it as well, for whom COVID on top of their current state of health would have been fatal. And so part of our decisions and protocols are about, I don't want an individual to get sick from COVID, but I also don't want an individual who might be who might weather COVID fine, passing it to somebody who can't. So those are two layers of considerations. And again, none of these things we use the term cure. And again, a lot of ways we think of cure and vaccine and treatment are movie based. So it's not that hard and fast. There are layers in their decisions based on those layers of protection, based on what we can make it through. I personally think I could make it through COVID. Well, I could have made it through. I got doubts about the Delta one, but I felt like I could have made it through having COVID based on my state of health and my past immunoresponses. But at the time, my wife was primary caregiver for her mother, who had multiple layers of health conditions. I pastor a church in which there are people who are immunocompromised because of transplantees, cancer survivors, or have other conditions where their immune system are compromised by the treatment, and people who are themselves healthy but are caregivers for people who are vulnerable. And so, personally, my decision to get vaccinated as early as possible was not a decision for my health. It was a decision for that second question, which is, okay, I owe the people I interact with as many layers of protection as I can give to them. I would still feel like I could have made it. I would have been fine. And those are the calculations that I made. Originally, I was not going to get the vaccine until at the earliest May or June. Like I was making appointments 4 and 5 months out. But those were the variables in my formula. And I think that those are the considerations I want us to have on the floor. I want us to get good information and consider both what are the percentages that I'm working with for my health, and B, what are the percentages that are affecting the health of others, because it's not just whether I can make it, it's about whether we can give it to somebody else. And again, back to my daughter was very clear that she didn't want me to come down there, didn't want us going down there. And she said to me, I don't want to make y'all sick, and I don't want to give y'all something that y'all can get to grandma. So those things are also part of the calculus. Go ahead, Bob.
Okay, and that's one of the things I want to answer those questions in the chat in 1 second. One of the things I do want to remind everybody, this virus has no rhyme or reason on who it makes sick and who it don't make sick. I know for myself, I have been through, I recovered from a pretty sick illness myself. And I remember when it first came out, and I was looking at people who were very sick, I had doubts as to whether I could muster up enough energy and willpower and all the other things that it takes to fight a disease. I wasn't sure I could do that. I just wasn't. Because there's one thing if I get a illness where I'm just having cold symptoms or just feel like I have a bad cold or the flu. But if I'm laying in a hospital bed on a ventilator, that's a whole different thing. And I guess when I had a family member who was the exact same age as me when she passed away, it really made it real for me. And I think that's for a lot true for a lot of people. It don't get real for them until they actually see someone that they care about suffer from this disease or die. So
Thank you, Barbara. Thank you.
there's a question in the box that say, how are children under 5 tested? Everyone is tested the same way. There are 2 ways to test at this point. The PCR test, if you have that test, you're not going to go, there's going to put the swab in your nose. You're not going to go as deep as you would the antigen test, which we also know is a quick test. In order to get enough, the PCR test is more sensitive, so you don't have to go as far down to get as much of the virus if it's there. But the antigen test, the quick test, you have to go all the way deep up into to the back of your throat. That's why you have to go down so far in order to get that test. So for kids, it depends on which test they're giving, whether they will, or kids or anybody, it's depending on which test you're giving, whether you'll go right into the inside of your nose, up to the like the bridge of your nose maybe, or whether you have to go all the way back to the nasopharynx, which is back to the back of your throat. Is it comfortable? No. Sometimes it depends on the person that's giving doing the test. For me, I've had both. For me, it felt like if you were in the pool and you went down and you got water up your nose and it burned a little bit, it wasn't comfortable. That's what it felt like. It shouldn't hurt or cause pain or cause bleeding or anything like that. Unless you have some type of nasal problem or anything, you might have a little bit more discomfort. Are there any tests? Are they tested the same way as adults? Yes, they are. And is there a saliva test for younger children? No, they usually don't do a saliva test for younger children because you may not get enough of the virus. But if there are tests available for people who have maybe a deviated septum or some other problem in their nose where they can't get the test. So if there's a problem, maybe you want to ask whoever is giving your test about that. My granddaughter had to quarantine because one of her classmates tested positive. Her daddy gave her a nose test after 5 days and she tested negative. Okay.
I am not seeing any of the questions in chat. I don't know what's going on my end of the screen.
This was a direct message to me.
Oh, okay. I got you.
Yes. I'm not going to call a person's name who sent the message. My granddaughter had a quarantine because one of her classmates tested positive. Her daddy gave her a nose test after 5 days and she tested negative. This is how the virus works. Let's say Reverend Graves is positive and he and I have a conversation. Neither one of us have a mask on and we are within 2 feet of each other. Reverend Graves is giving the virus off. I'm taking it in. It depends on how much I get into my body. And I'm going to get some. I'm not vaccinated. I don't have any immunity. So the virus gets into my body. I don't have any immunity against it. So all of a sudden it starts replicating, meaning it starts dividing and increasing. That first couple of days that this is going on, if I get a test, more than likely, I'm not going to feel sick. This is all going on in my body. I don't know what's going on. I'm not going to feel sick. Nothing's going to happen. But somewhere between 2 to 7 days after I am infected with the virus or the virus has gotten into my body, I may start having symptoms. And at this time, I'll have enough virus in my body in order to test positive for it. And then I'll be able to get a test. So that's why we tell people to wait 2 to 7 days after they have been exposed to the virus in order to get a test. At 5 days, if she is positive, more than likely she will test positive. And if it was we have noticed sometimes though with those quick tests, which is what what your granddaughter may have, sometimes they are not as sensitive at that point and you need to be retested. Even though I have not tested negative, I've tested negative at that 5-day mark, my body still may have not replicated enough that I could still be positive, but there may not be enough of viral load in my body to test positive. But that does not mean I'm not positive. So we ask people who have been exposed, who we known exposure, to wait anywhere from 7 to 14 days, depending on the circumstances, before they can go back out in public. Because at that point, we pretty much know that they are not infected by the virus, because it could take anywhere from 2. I have seen cases where people who had exposure, but they did not test positive or start showing symptoms until on that day 14. So it could be anywhere from 2 to 14 days after you've been exposed where your body will start showing symptoms or you will test positive. So we can't look at what happened to my cousin or somebody else, neighbor down the street. We have to treat everybody the same at that point, because we don't know how it's going to occur in your body in order to make people safe. And I think that's one of the reasons we're so confused, because exposure causes you to be, you have to quarantine for so many days. If you actually have a positive test, you isolate for 10 days, and it's all kind of, the best thing to do is to call your doctor, or call someone that knows, who deals with this every day, to see what you need to do. Because it depends on whether you were exposed, when you were exposed, and how your body will react.
Hey, Barbara,
Yes.
this is Teresa. You mentioned that some people are not show signs of being exposed in 14 days.
Yes.
In that time period, can they transmit the
Yes.
virus to others?
They can. If they have enough, yes, they can transmit the virus. There are people who test positive. They had no idea that they were positive. They never have symptoms, but those people are shedding the virus. What we mean shedding the virus, that means that they are you can actually be around them and get the virus from them. Some people show no symptoms whatsoever. So that is why when if your kids are at school and they have an exposure, they're asking everybody around those kids to stay at home for 10 to 14 days. I'm not sure which one the school is using right now, but anywhere from 10 to 14 days based on what we know how the virus sheds and how long it could take your body to get enough viral load to cause symptoms or to cause a positive test. Did that help, Teresa?
Sure. I can't. Oh, where am I?
Okay.
Oh, yeah.
Okay. There's another question. What is the best way to encourage someone who does not want to take the vaccine to take it? Constantly asking or leave it alone. I have learned that hounding them or telling them things are not going to help a lot. One of the things I've learned is to let them tell me why they don't want to take the vaccine. Some people have legitimate reasons for not taking the vaccine, and I kind of understand. Some people we look at things that has happened to us in the past. I am so aware of things that have happened to us, especially our race in the past with research projects. One of them that's mostly brought up is the Tuskegee Institute case. I've also learned though that a lot of us don't know exactly what happened in that case with the men in that case. in that study, rather. A lot of us think that the men were actually given syphilis and not treated. All of the men in the study contracted syphilis either in everyday life. There was one case I was reading about not long ago where the gentleman actually got it from his mother. That is one of those diseases that you can contract, congenital syphilis that you can get from your mom. That's why we're so careful about testing mothers to make sure that they don't have syphilis before birth. But the men in the case were not given anything. What happened with them, they were withheld treatment. And that is not something that is right by any means. I have recently started working in the research department at my job. And one of the things I've learned that from the Tuskegee Institute, there were so many laws that happened that governs how researchers work. So that was one of the good things that happened because of the Tuskegee Institute study. There are so many laws that came through for research that should never happen again. You know, as I said, that should never happen again. As long as we have imperfect people working in places, we all know that there might be cases where people do things wrong. That's in any job you have. But those people are fined, those people lose their jobs, those people lose their privileges, and they're not able to do research again or anything. Not only that, but any research you have done will be snatched from you and never be published, never see the light of day. So what happened with the Tuskegee, if that is your reason for not getting the vaccine, what happened with the Tuskegee Institute case is totally opposite of we're trying to get people to take the vaccine now. So that's not really a good argument, because at that point they were withholding treatment. What we're trying to do now is give the vaccine. Again, remember I said something about we need to look beyond our own back door, look at what's going on in the world. We in this country are throwing away vaccines because they are expiring. We can't give them anymore because they're beyond the level where it's good. We have brothers and sisters who are in Haiti, who are in Jamaica, who in some of these other Caribbean countries who don't have the means that we do, that would love to have those vaccines that we are throwing away. We can't just send them to countries and everything, because there are laws that govern from each country and everything about what medicines and what biologics and things that can be transported from one country to another. We are kind of loosening up some of those things now, where we are sending those vaccines to other countries, but it just breaks my heart knowing that there are brothers and sisters all over the rest of the world who would give everything they have for the vaccine, but we have it here for us, and we're hesitant to take it because of a lot of misinformation. And that's another thing I want to please. I know we say that do your research. Please don't let your research be any social media page. The last couple of weeks, I have gotten so disheartened about some of the things that I'm reading on social media pages. I was working last night until about 9:00 at an event on campus. It was for Black students and everything. And I mentioned I work for a research project that deals with healthcare and everything. A young man came up to me and told me that he was talking about just medicine in general, that we as Black folks shouldn't take any medicine. You know, and I was talking to him and everything, like, why do you believe that? And he started telling me different things that he believed that. My conversation ended with this young man because he got to the point that he told me that Black folks shouldn't even eat, that we have the ability in our bodies the only thing we need is water and sun that will keep us alive. My conversation stopped with this young Black man at this point. Because there I could see that nothing I say to him was going to matter. We had this conversation about if I had a heart attack right then. He told me that I don't need medicine, and I could just, my mind could just control my body and stop me from having a heart attack. I'm so glad this young man's major is not medicine or anything to do with healthcare, because I would never want him to be responsible for me. So that's, I don't know. Back to the original question, I don't know how to, I wish I know, because I think the more we teach, the more we give the correct information is the key to getting more people to get vaccinated. If you're doing research, please make sure that you are looking at credible sources. I'd say most of what you're reading on social media is not a credible source. Make sure if you're on the internet that the last part of it says .gov or either .org or some type of health, say it's fact checked, something like that. Please don't read those articles that anybody could post. Also on YouTube, there's a lot of people saying that they're doctors, that they're this and they're that. Do they have those credentials? Make sure you check them out to see that they are really credentialed before you believe what they say. There's also one other question I remember I did want to talk about was symptoms. We all know that there are a lot of the symptoms of COVID. We've heard them: loss of taste, smell, fever, cough, shortness of breath, difficulty breathing, muscle aches, body aches, nausea, vomiting, diarrhea. Don't think you have to have all of those in order to have COVID. If you have any of those symptoms, you don't have to have all of those symptoms in order to have COVID. Like I said before, you could have no symptoms, but you could be positive for COVID, and you could be infecting other people. One of the other things I want to mention is we do have, we've been saying that there's no cure, but we do have there is one medicine. I know we've heard a lot of information about several different medications that have been suggested, that's shown to have been proven to cause more problems than good with this virus. However, there's one treatment called monoclonal antibody drugs. These are two drugs that are given together, and the other name for this is Regeneron. If you are positive, please get in touch with your primary care provider. It is here in Tuscaloosa. If you're in Tuscaloosa, it is available. And getting it within 10 days of symptoms or either testing positive has shown to keep people out of the hospital and also get over the symptoms of the virus a lot quicker. But you need to do it very, very quick. So as soon as you start having symptoms, I would suggest that you go ahead and get tested. And then if you're positive, get in touch with your primary care provider so that you can get the monoclonal antibodies. They are proven to be very effective against the treatment of the virus. This is actual treatment, is not a vaccine. A vaccine will hopefully prevent you from getting the virus, or not. Let me make that clear. A vaccine will not prevent you from getting the virus. It will prevent you from getting sick from the virus. Just because you have the vaccine does not mean that the virus cannot go into your body. And I think that is one of the things that we tend to say wrong sometimes. The vaccine will not prevent you from getting the virus. It will prevent you from getting sick from the virus. It will make your body build antibodies and fight the virus off. It will not prevent you from getting the virus. I think that's one of the things that we say in healthcare sometimes that kind of confuses people. So it won't prevent you from getting the virus, but it will prevent you from getting sick or dying from the virus, or increase your chances of not getting sick or dying from the virus. the monoclonal antibody therapy is actually a drug that will treat the infection. So those are some things that are that you should look at when that is available now. This is the same drug that was not available to most of us last year, but it is more widely available now. Any questions about? Any other questions?
Regina, go ahead.
Yes, Barbara, I was wondering, are there vitamins that you know of that are helpful in building your immune system against this virus, like vitamin A, vitamin C, and zinc? And the reason I ask is because I had gone to the doctor once and they had these vitamins that, you know, that they were selling that it's supposed to be helpful in building your immune system. Do you know of anything or heard of anything like that?
Yes, those are, I'm hearing quite frequently that vitamin A, I think vitamin D, zinc, and several other vitamins that are being suggested. Yes, people, anything that you can do to boost your immune system at this point, eating right, getting enough sun, taking the vitamins and everything. Yes, those are very important to do. I'm not going to say don't do them, especially if your doctor is saying. However, if your doctor is selling them.
Well, you know, at this particular office, they had a lot of different things that, you know, you could buy. But these were packaged together, like bottles of vitamins packaged together that, you know, you could purchase during the time of, you know, when it was really, really high risk of getting it.
There's no research to say that taking any vitamins would increase your chances of survival from COVID-19. Again, though, we all know that anything that you can do to make yourself healthier, a more healthier body will more than likely be able to fight off any virus better than an unhealthy body. So things to boost your immune system, and we hear this every year, you know, take vitamin C to prevent colds and everything. Yes, I can take vitamin C, but if I'm exposed to enough of the virus that causes a particular cold, it's probably not going to keep me from getting the cold, but it will help my body boost my immune system where I can fight it better. But again, like I mentioned earlier, these things change day to day on how our immune system is working and everything.
Okay, and one more question. My granddaughter she had COVID-19 last year. Her smell still hasn't returned. Is this something that will be indefinite, or what can she take, or do you know, or have you heard of anything as far as how long that lasts, or?
Most people, sense of taste and smell returns back within like a month or two. Some people are going for months and their sense of taste and smell has not returned. Unfortunately, these are some questions that we don't know because, again, this is something that has never happened before. And not saying that the virus is not, and that's another thing I wish I should have started talking about this. I meant to, and I didn't, I forgot. One of the things that how did this happen in the first place? How did a new virus come about? Does that not mean that it was made in a lab or something? I can't say it wasn't made in a lab. I don't know. But most viruses are in nature already, meaning that some type of animal have that virus already. It does not affect the animals, but if it somehow jumps from animals to humans, either by ingesting it or people being around it or some reason that the virus all of a sudden get to people, You've heard this before. You've heard of like viruses that affect birds or something, but now it's over to people. Somehow it's gotten to people and it's causing havoc, such as bird flu or something like that. Viruses are in nature every day. It jumps from animals, which it may not affect, or it may affect, just don't ever know. But once it gets to the human population, we don't have any cure for this. We don't know how to affect humans. We don't know, we don't have treatment for it. And that's where we are now. We've had a virus that somehow got into the human population. We don't know how to deal with it. We don't know how to manage it. Also, viruses mutate, meaning that they change. That's the nature of a virus. If you just put a virus out here on a table or something, it won't do anything to anybody. In order for it to replicate, in order for it to change, replicate means that it grows and changes like normal cell division and just populating your body. More of it is made in your body. When it mutates, that means that it changes. It gets smarter. And it's just like anything else. It don't want to die. So it's going to make itself stronger and stronger and stronger. Viruses do this, bacteria does this, all kind of organism does this. It makes itself, so it mutates and gets stronger and stronger and stronger. So one of the things that happens with this virus is that it gets in your body, it replicates, and as it starts replicating, it mutates, it makes itself stronger, and it goes to the next person and figures out a way to go against that person's immune system, make itself stronger, make itself stronger. That's one of the things that happened with HIV. It started mutating so fast, and that what we call the wild virus, the virus that was initially that came from the whatever source it came from in nature to the human population, it may not even look like the wild virus initially, but now it's all of a sudden it mutated into something that's just totally different. This is one reason we're asking people to get vaccinated too, because we want to stop this mutation process. We've seen it already with what we call the alpha or the wild virus. It went through, it caused all these problems. Now we're dealing with the Delta virus. There are actually about 13 mutations of the virus that we know of right now. About 4 or 5 of them, I believe, are causing concern that we're looking at very, very closely to see if they will be like the Delta virus are. One that we're looking at now is the Gamma and the Lambda virus. There's a few people in the states that actually already been positive from this, not this state, but in other states who already been positive from these viruses. We don't want another Delta virus that's causing more problems. That's one of the reasons we're pushing people so hard now to get the vaccine, because we need to stop the mutation process. There's several ways to stop a virus. The ways that we stop a virus, and we've been through some of them, was, the reason that we shut down in the play, we ask people to stay at home. If the virus can't go from person to person, it can't mutate, it can't grow, it can't do any of those things, because once it get into your body and you go through that disease process, it's gone. You won't be able to shut it. Your body has built up antibodies and you can't keep giving it to people. But if we keep getting around people, doing things and spreading it, it has a chance to just spread like wildfire. It just keep going, going, going. So that's why we ask people to social distance, to not be around each other. That's why we shut the country down. It wasn't to make everybody mad and cause all kind of havoc and shut down businesses and anything. That decision was made in order to stop the spread of the virus, to stop it from going to person, so it will not have those chances to just keep making people sick. That's why we wear the mask, is to keep our viruses to ourselves, and that's why we need to wear the mask correctly. I always forget to bring a mask. We always wear the mask. We see people with the mask hanging down over their nose. I've seen a young man yesterday, the mask was on the back of his head. It wasn't working at all. But wearing that mask correctly, meaning over your nose and over your face, fitted and everything to your face so that it can, as much as possible. I've also heard people, talk about the fact that, the mask cause all kind of, decrease your oxygen level, make you decrease your immune system and everything. If this was the case, my immune system would be nothing. I have spent more days in the operating room than I can count with a mask on. think about your surgeon. If you had a surgery before, that doctor is in a room all day. Think about the nurse that worked in an operating room. She's wearing a mask all day long. None of these people complain about decreased immune systems or decreased oxygen to their brain or anything. Would you want your surgeon? You think we would have people in the hospital with a mask on if we thought that they're all of a sudden they're not getting blood or oxygen to their brain? We would not have them doing these very high level procedures and everything, knowing that they're being compromised, their brain's being compromised. I just don't understand why people would think, especially the mask is causing all these type problems. So that's what mask does. The vaccine, like Reverend Graves was just mentioned, these levels of protection, the vaccines provide protection to make our immune system be able to fight the virus. And that's those things, social distancing, vaccine. And now we do have a treatment for the virus, for the infection, the monoclonal antibodies. That's another level of protection. So all those things, social distancing, the mask, vaccines, all these things work together. And until we all kind of like get on board and do all of these things, this virus is going to continue to infect, multiply, mutate, and just keep on causing the problems that we have. Like, we were getting better, you all, and now we're back to where we were in March, and well, before then, January, December, January, February, we're back where we were. There's a question. Did I understand that there's a 3% chance of contracting the virus if vaccinated and are masked? The that 3% that we just gave, that was of the people who died in
0.03.
Alabama. Yeah, it was actually 0.03%. Of the people who died in Alabama from COVID-19 from April 1st to August 18th, there was 982 people who died from COVID-19. Of those, 3 people was fully vaccinated. And that's where we got that percentage from, 0.03%. That's where we got that percentage from. If right now, if you are fully vaccinated, the research is showing that of the fully vaccinated people, about the cases that are positive, about 10% of those people are fully vaccinated. So your chance of, based on the numbers, being fully vaccinated, you have about a 10% chance of being positive. A lot of the people that we're seeing who are fully vaccinated and are positive they have been around people. Of course, you have to be around someone in order to get the virus at some point. I know there are some people who have no idea. They will say, I have no idea. I wear my mask all the time. I am never around people. I don't go anywhere. But then you start talking to them. Maybe I stay at home every day, but my grandchildren come to visit me. They don't wear a mask. My children come to visit me. They don't wear a mask. My friends come to visit me. They don't wear a mask. So you are being exposed. So you need to be very diligent. Those levels of protection that we talked about, wearing a mask, social distancing, whether you know a person or not, whether they're your family or not, you need to protect yourself when you are around others, especially if those other people are in close contact with everybody else. So I hope that you do. It's not a 0.3% chance of you contracting the virus, but you have, if you are vaccinated and you are in contact with other people, it looks like you have about 90%, about 10% of those people who are positive are fully vaccinated. I hope that makes sense. It's a treatment given to all individuals who request it, or are there guidelines? The only guidelines for the treatment is if you test positive, you are very sick, and sometimes if you are also have some, if you are in a certain, if you have more, oh good Lord, I'm sorry, sometimes the words won't come. If you're in increased risk of getting, being sicker or dying from COVID-19, and some of those things are if you have diabetes, high blood pressure, if you're obesity, diabetes, high blood pressure, obesity, any immune system disorder, if you have some type of renal, like you're on dialysis or some type of renal disease, of course, elderly, those people are at higher risk of dying or getting very sick from the vaccine, from the virus or infection from the virus. So those people, if you have any of those conditions, please go ahead and look into getting the treatment. However, if you are very sick and you're very symptomatic, if you're positive, if I'm positive, I would go ahead and call my doctor and talk to them about whether, and they will make the decision about whether you need the treatment. But especially if you're in one of those cases where you are high blood pressure, diabetes, obesity, immune compromised in any way, taking any type of drugs that suppress your immune system, if you are cancer patient, any of those things, you need a dialysis patient, you need to quickly get the treatment if you are positive. These are great questions, you all. I hope we're answering. I hope you're understanding the answers. Any other questions? Again, in our state, as of yesterday, only 36% of our state population is fully vaccinated, and 47% of our population has had at least one shot. So we still have a long, long way to go. So. Any other questions? I have been talking with a lot of my friends and everything that are in the school system. They were saying that they are really proud of their students because a lot of them are wearing masks. And they're not having to have as much trouble with the kids as they thought they would sometimes with wearing masks. Saying that there are quite a few kids who do not wear masks. It depends on which school you're at and everything, I think. As you all know, that the county school systems, there's no mask mandate, but there is one in the city school systems. I think all of the colleges are requiring masks, at least inside the buildings and everything. However, I noticed, like I mentioned, I was at a pretty large event last night on the university campus, and there's no masking if you're outside, but I would highly recommend if you're in big crowds, wear a mask. I know I did not even take my mask. I didn't even eat at the event last night because that would have meant I had to take my mask off for at least 15, 20 minutes in order to eat. I felt like I was safer with my mask on. And we all have to make these decisions for ourselves. So. One of the things I think we don't talk about a lot, we talk about the disease process and social distancing, wearing masks and things like that. We don't talk about how this is affecting individuals. We don't talk about how we're coping. And I know for myself for today, this has been a trying week. I have there have been many times that I just wanted to just go in a room and not come out for a week or so because I'm so frustrated at this point. And I think having that conversation with that young man last night just sealed it for me that I need a little break. But we need to figure out how to cope with this. Some of the things that we can do is just take a moment and just, get off social media. Don't look at the news. Don't look at anything. Do something fun with our families. That's what I plan to do today is just after we finish here, I'm going to watch movies that I don't have to think. I'm going to read something that I don't have to think. I'm just going to decompress the rest of the day because I don't think we do that enough. You need to take care of your bodies. Several people have mentioned here today, do things to bolster your immune system. I've heard many times that I'm reading, especially with the younger population, that group between the 19 and 49, about their boosting their immune systems and eating right and everything. Yes, nobody has ever told you not to do those things. Every time I've ever gone to my doctor or anything, I've been told to eat right, exercise. Those things are still very, very necessary. So you do need to eat right. You do need to exercise. Plenty of fruits, vegetables, decreasing fatty foods, things like that. Those things have not changed. We still need those things. However, we need some protection on top of those things in order to not get sick. Reach out to others, especially other individuals, especially in the cases where we are having to do so many things virtually. We need to reach out to others, find ways to get some human contact. That's very, very important. If you're feeling overwhelmed or just unsafe at this moment, please reach out to somebody quickly at those points. I'm sure Reverend Graves will be happy to talk to you. I would be happy.
Yes, he will.
Yes. If I can help, I would be happy to talk to you. I'll answer any questions. If I don't know the answer to a question, I will find it for you. One of the other things, those of you who are, especially people who are kind of wondering about being vaccinated, many jobs have already started requiring vaccines in order for you to work at these jobs. Well, I can't say many jobs outside of this state. I think in the state of Alabama, the only job that has required it at this point is University of Alabama Health Systems, meaning UAB hospitals. They are requiring you to be vaccinated. I think it's by the 1st of November, somewhere the 1st of November, all of their employees, if you plan to work at their facilities, you will have to be vaccinated. Of course, there are cases if you are, have some health problems that prevent you from getting it, or if you have certain religious restrictions that you can't get the vaccine. Now, don't think you can say you really have to have documentation in order to get to not have the vaccine based on religious reasons. You just can't walk up and say, such and such religion, I don't do it. You have to have certain type of proof, okay?
As the hosting pastor for this meeting, let me say definitively, there is nothing in Methodist doctrine that mandates that prohibits you from receiving the vaccine or fully following any of the CDC guidelines or any of the advice that Barbara's given you. If you have some other personal religion, that's you and your YouTube religion is you, but there's nothing in Methodism that would prevent or prohibit you from following those guidelines or complying with those directions and advice.
Thank you, Reverend Grace. And I'm, I don't, about a week ago, I actually heard someone from a particular religion that I'm not going to even say the name of the religion, who their followers do not get vaccinated, their kids don't get vaccinated, nobody, but he was advertising in order to get more followers, that was his advertisement, to get more followers, that if you're part of this religion, you don't have to be vaccinated. That's a little scary to me. So
there's I'm sorry, I'm trying not to go down that rabbit hole, but there is something fundamentally wrong. I'm not declaring anything about anybody's religion, theology. That's not what I'm saying. But hear what I'm saying. There is something fundamentally wrong if someone says, hey, God does not want you to get vaccinated. But then they say, B, but the Lord wants you to buy this package of water, chemicals, minerals, pills, or anything else that I have that will stop you from getting the virus. There's something ethically and morally wrong with those two statements together. If it's one, you deal with that. If it's the other, you deal with that. But if somebody's saying both those things at the same time by the same mouth, God does not want you to get vaccinated. God does not want you to wear a mask, but God does want you to buy this from me to keep you from getting the virus. There's something wrong there. And you can tell him I said that.
Reverend Grace, would you please put my number in the chat? I've kind of gotten mixed up here with the chat box also.
Yes, ma'am.
My number is 205-242-9027. If I don't answer, it's because I can't answer at that point, but I will call you back as soon as I can if you have any questions. Again, like I say, if I don't know the answer, I have access to some of the best minds and that's working with this virus right now. So I will happily ask them the question and get the answer to you. Any other questions that I can't think of anything that I didn't cover at this moment. If we're about to end, I would like to say, please, as Reverend Grace often say, let's be stewards of each other's health. It is so important right now that we are diligent in making sure that we conquer this, because if we don't conquer it, I don't know where we're going to go. We see these mutations. We see that we have so many people that are using so many things to fight against this. It saddens me so much that some of the very people who are telling our people not to get vaccinated, or telling any people not to get vaccinated, they themselves are vaccinated. So I don't understand that. I know what the last two things are. I promise you all that it's so much, and it's happening so fast that it's kind of hard to remember it. These are some things I jotted down. If you have any type of immune system, if you're immunocompromised in any way, meaning that if you have you're taking any kind of drug, if you had a transplant, and you're taking some drug to suppress your immune system. If you're HIV positive, you are eligible right now to get a third vaccine. These people who are very, very sick or immunocompromised, their bodies are not able to, even if they're vaccinated, they don't have enough immunity to stop the virus. So at this point, you are eligible at this moment to get a third vaccine. You can go to any drugstore, or Winn-Dixie, DCH, University Medical Center are all giving those vaccines. Call and make an appointment. The CDC have also authorized that people who are not immunocompromised will start getting a booster shot. The booster shot will start, I think it was September 15th. I believe that date is correct. And it will start out, you will be eligible based on the time that you were eligible for the vaccine initially, meaning that frontline workers, frontline healthcare providers, and nursing home patients will probably be that first group, and then they will go down from there. So we are seeing that, and the reason that we are that they are asking us to get a booster shot is because they are looking at how your immunity is waning after you've had the vaccine for a certain time. And I guess again, we are learning as we go. Unfortunately, we are learning as we go. So we're learning that the immune system is not fighting the virus, as that's why we're seeing one reason that we're seeing more and more vaccinated people get the virus or be affected by the virus. So we are getting a booster shot. I think I explained in another meeting that we had, the booster shot is like, everybody is very familiar with the booster shot. You know, we all get a tetanus booster shot in every few years, every 10 years, because your immune system is not able to provide them the needed amount of antibodies that you'll need to fight the virus. So you'll be able to fight that particular organism. You'll need a booster every 10 years in order to get it. I remember a few years ago, my job required me to get a whooping cough booster. I didn't have whooping cough or anything, but because there was increased cases in our community, our job required us to get whooping cough vaccines. So this is the same principle behind that. The reason I bring up these examples, I want you to realize that these are not new things. These are things that we have been doing, booster shots, things like that. We've been doing this for ages, and these things have been clear. One other thing I want to bring up is people wonder sometimes, why is this free? You know, nothing free is free or anything, but that's not the case also. The person who actually came up with the polio vaccine, none of us remember polio and everything because it's pretty much been eradicated through vaccines, and we don't see polio anymore. But the first guy who developed a vaccine for polio, he did not get a dime. He would not take a dime for his invention with that. It was always free, the vaccine that he did. So this is not new. None of these things are new. You can look these up anywhere, maybe not on social media, but you can look at any other reliable source and read about the history of vaccines. And I would encourage anybody to do that. Read the history of vaccines and where they've been and everything. And I'm going to stop now because we could go on 2 or 3 more hours with this, but unless anyone have any questions, I'm going to end right now. Okay.
Again, let me encourage anyone, if you have a question that has not been answered, in the interest of time, if it's possible, you're willing, if you would unmute yourself and go ahead and share those.
And your booster shot will be 8 months past your second vaccine. If you have the Johnson & Johnson vaccines, those guidelines have not been placed yet. So if you've had the Moderna or either the Pfizer, you will be getting your booster shot 8 months after your last vaccine, your second vaccine. If you got the Johnson & Johnson vaccine, those guidelines have not been given yet as to when you would get your booster shot.
All right. For the Bailey Tabernacle family, an email will be, I'll be forwarding an email to Regina in the next 24 hours regarding our current hiatus from in-person worship. We will be posting worship as a video this Sunday morning. So that will post the old way, the way we were doing it before we came back. Look for that on our social media. Particularly just look at our website for that to be posted. Just be watchful for your emails. Notices will be going out about what we're going to do with this, taking all this into consideration. Let me thank Barbara in particular for all that she has done. You can tell the work she's put into, just the work she puts in the healthcare sector with COVID-19, and also the work that she's put in being prepared for this and to answer everyone's questions. Thank you to all of you who are on. Please share the information that's been shared with you. Barring any technical difficulties that I haven't anticipated, I'll be posting the audio of this conversation to the Bailey Tabernacle CME Church website this afternoon as soon as I can get everything downloaded, uploaded, and correctly added. So look for that to be online. Just give me till tomorrow, along with our worship. Are there any questions for me? Any pastoral type questions for me? regarding the church's response to this? All right. Reverend Lewis, are you still on with us? Can you unmute yourself?
Yes,
Would you close us with a word of prayer, please, Reverend?
yes, be glad to. Thank you. Father God, we come now in your holy presence with hearts of thanksgiving and praise. We are yet so thankful for your wisdom, for your knowledge that you have imparted to us today through Sister Barbara Jernigan and our pastor, Reverend Graves. We just thank you, O God, that you have given us a better understanding of this COVID-19 and methods and things and wisdom to be able to deal with this disease and this virus. We just thank you, O God, for those who have asked questions and given us a better insight as to how we are able to cope with this present day pandemic. And we just pray, O God, that through all that we have learned today, that we will be able to have better lives and better understanding and be able to go out and share the good news with others who were not able to participate in this discussion. We pray, oh God, that you will continue to just provide us wisdom and knowledge, that we will be able, oh God, to better serve in your kingdom and to better serve others, oh God, that they will be uplifted and edified according to your will. And we just pray, oh God, that we will continue to be good stewards of one another and continue, oh God, to just put our trust in you where we do not understand everything right now. We know that if we will continue to trust in you with all our hearts and lean not to our own understanding, but in all our ways acknowledge you, you will continue to direct our paths. We pray, oh God, that you continue to provide the leadership that you are providing, the wisdom and knowledge that will better lead us to a greater understanding. And in all that we do, let us continue to give you praise, honor, and glory. In Jesus' name we pray. Amen.
I'm muted. Thank you, everybody. Hope you have a wonderful rest of your afternoon. And again, thank you, Barbara. God bless you.
Thank you,
Bye.
Barbara.
Amen.
Thank you, Barbara.
Thank you, Barbara and Reverend Graves. This was
Thank
excellent.
you all.
Thank you.
Thank you.